Hello, my name is Michaela Kearney, and today I'm going to be speaking to you about the kinesiology that is involved in the posting motion for equestrians. The motor skill is the posting motion that's done by equestrians while the horse is in a trotting state, a motion that is similar to a squat. There are many movements that are done by equestrians that require the strength and stability of the legs and torso. Posting requires the most movement and is similar to a squat that's on the ground, except now the rider has to move in a fluid rhythmic motion with the horse's stride, as well as be in a squat position. This movement involves lower leg strength and flexibility in the hips, knees, and stability in the core muscles. The posting motion is broken down into two different phases: the rising/forward phase and the lowering/sitting phase. The rising forward phase, the movements involved are an extension of the hip, knees, while holding ankles in a flexed position. The rider moves in the sagittal plane, similar to the squat. They move around the frontal axis. The pelvis, femur, tibia, and tarsals are used, and the hip, knee, and ankle joints are used. The same plane of motion, axis, bones, and joints are involved in the lowering/sitting phase. The only difference in this movement is the flexion of the ankle, knee, and hip. So every joint's in flexion instead of the knee and hip being in extension and just the ankle being in flexion. Here we have a visual breakdown of the lowering/sitting phase. And the red line shows us that we're moving in the sagittal plane. The orange line with the arrow right here shows us that we are moving around the frontal axis. The blue circles here, here, and here show us that the hip, knee, and ankle are in flexion. The rising/forward phase, the red and orange lines are used to show the plane of motion and the axis used. The orange arrow here shows us which way the rider is moving. The blue circles show that the hip, knee, and ankle are in extension. The ankle, stays in flexion. The muscles used in the rise/forward phase are the gluteus maximus, biceps femoris, rectus femoris, gastrocnemius, posterior tibialis, and abdominal erector spinae. That muscle is in the torso and stabilizes the pelvis and the trunk. Here are the list of origins, insertions, and innovations for the muscles that are used. I'm going to go over this in a couple of slides and break it down in a table with visual. So we'll come back to that in a few minutes. The roles of muscles in the rise and forward phase. The agonist muscles are the gluteus maximus, rectus femoris, gastrocnemius, and soleus. The antagonist muscles are the biceps femoris and posterior tibialis. Type of muscle contractions. Almost all of the muscles perform in a concentric contraction during this phase, except for the abdominal rectus spinae, which is in constant isometric contraction because that's used to stabilize the upper body. The possible effects from alterations to muscle recruitment is if the lower body muscles, so the muscles in the legs that are used to drive the rider up out of the saddle, are not developed enough or not strong enough, the rider must then use their arms to pull themselves up and will fall backwards into the saddle without control. So here again, the same muscles are used in the lowering/sitting phase, gluteus maximus, biceps femoris, rectus femoris, gastrocnemius, posterior tibialis, and the abdominal rectus spinae. Except they all have slightly different roles, except for the abdominal muscle that still stabilizes. But the other muscles are used differently in this movement than in the rising/forward movement. The roles of the muscles in the lowering/sitting phase. The agonist muscles are the biceps femoris and the posterior tibialis. And now the antagonist muscles are the gluteus maximus, rectus femoris, gastrocnemius, and soleus. The muscles are now in an eccentric contraction. The abdominal muscle is still in isometric contraction because that stabilizes the body. And the same effects from alterations to muscle recruitment is for this phase as well. So if the rider's lower leg muscles are not developed, they will use their arms to try to support their body weight as they lower themselves. And they also try to use their arms to pull themselves up to control their body. Here is the visual breakdown for the rise and forward phase. So the rider's ankles here are centered underneath the hip and the shoulder to the ear. They're driving themselves up with their lower leg, and their arms are out in front of them. They're not pulling themselves up with the reins. They are balanced and they're forward. Here is the list of the muscles that are used. Their origin. So the gluteus maximus originates in the dorsal ilium, inserts in the iliotibial band in gluteal tuberosity, and innovates in the gluteal nerve. It's an agonist in this motion. Biceps femoris originates in the ischial tuberosity, inserts in the head of the fibula and lateral condyle of the tibia, and innovates in the tibial part of the sciatic nerve. It's an antagonist, so it's supporting the rider. The rectus femoris originates in the anterior iliac spine, is inserted in the base of the tibia, patella, and innovates in the femoral nerve. It's an agonist, so it drives the rider up in this phase. The muscle gastrocnemius originates in the medial lateral condyle of the femur, inserts in the posterior calcaneus, and innovates in the tibial nerve. It's also an agonist, so it drives. The soleus originates in the posterior tibia and fibula and inserts in the posterior calcaneus. There is no innovation for this muscle, and it's also an agonist. The posterior tibialis originates in the upper tibia and fibula. It inserts in the navicular cuneiforms and cubic bones, has no innovation, and is an antagonist, so it's supporting. The abdominal rectus spinae originates in the thoracic vertebra and superior pelvis, inserts in the posterior ribs and superior thoracic vertebra, has no innovation, and is a synergist, so it stabilizes the upper body. Here's the visual breakdown for the lowering/sitting phase. So the rider keeps the tilt with their shoulders. The arms are still out in front of them. There's a bend to the knee with the ankle underneath the hip, and they're sitting lightly on their seat. They're balanced and supporting themselves with their lower leg. The same muscles are used, have the same origins, insertions, and innovations, except now their roles are slightly different. So the gluteus maximus is now an antagonist. The biceps femoris is an agonist, so it's helping to pull the rider down. The rectus femoris is an antagonist, supporting the rider. The gastrocnemius is an antagonist, it also is supporting. The soleus is an antagonist, so it's supporting. The posterior tibialis is an agonist, so it's pulling the rider down, and the abdominal rectus spinae is a synergist, it's just there to stabilize. The proper versus improper posting position. So here on the left, we have the proper posting position, the rising phase, and the lowering phase. So the goal is for the rider to drive their body weight up with their legs without assistance from their hands. So if they have developed rectus femoris, glutes, and gastrocnemius muscles, this movement will be easy. Here is the lowering phase. In the proper position, the rider is supporting their body weight with their lower leg, is not falling in the saddle, which allows them to then rise again in the motion of the horse. The rider has developed rectus femoris, soleus, as well as abdominal rectus spinae muscles, which keep their upper body tight and stable. Here on the right side of the screen, we have the improper rising motion and the improper sitting motion. Here you can see the rider is pulling themselves up with their hands instead of driving with their legs because their rectus femoris, glutes, and gastrocnemius muscles are weak and underdeveloped. On the very far right is an example of a rider that is falling back into the saddle, dropping their back, kicking their leg in front of them, and trying to balance themselves with their arms. They're not controlling their body. Their erector spinae muscles are not able to stabilize their upper body, and their biceps femoris, soleus muscles are not able to support the body in a fluid, balanced lowering motion. The biomechanical factors, rising and forward phase. The center of gravity is centered from the foot through the back of the knees, hips, up through the shoulders and the ears. They should be at about a 25-degree angle. The hip is a second-degree lever, second-class lever. The knee is a third-class lever, and the ankle is a second-class level. The mechanical advantages. Riders that have shorter legs and torso have less stability and strength than those that have longer legs and torso. The longer the force arm is in the lever, the easier the motion is going to be and the more stability that the rider has in that motion. Some effects from the laws of motion. The second law of motion is directly related to posting. The amount of force that acts on an object must equal the weight of the object. So in order for the rider to rise out of the saddle, the force in the lower leg must equal the weight of the upper body. The biomechanical factors of the lowering/sitting phase. The center of gravity is still through the midfoot, back up through the knees, hips to the shoulders and ears. The rider's hips should now be at about a 45-degree angle, a little bit more than when they were rising. The hip is a second-class lever, the knee is a third-class lever, and the ankle is a second-class lever. The same mechanical advantages for the lowering/sitting phase that as well, they're the same advantages. So the longer the legs, the longer the torso, which means a longer force arm, which means more stability for the rider. And the same effect that laws of motion have on the rider, the second law of motion is related to posting. Again, the amount of force that acts on an object must equal the weight of the object. So in order for the rider to support themselves, that weight of the body coming down with gravity, the lower leg must have the strength to support that. Here's a visual breakdown of the location of the levers, the fulcrum, the load, and the effort. So here on the left is the rising, and here on the right is the sitting. So the hip lever, here is the fulcrum. The load is the upper body coming down, and the effort is the upper leg going up. The fulcrum for the knee is at the joint of the knee. The load is the upper body and the upper leg the effort is the lower leg, and then the fulcrum for the ankle is the ankle, and then the load is the upper leg and lower leg, and then the effort is here at the foot driving up. So this is a little different than what you would do with a squat, because you're driving more off of the center of your foot. The load and effort are a little different. Here, because you're driving more off of your heel, the effort's coming from your foot and the load is coming from your leg. The location of the fulcrum, the load, and the effort are the same for the sitting motion. It's just the angles are slightly different. Here's a proper versus improper posting position and how that affects the levers. So on the left here, we have the proper posting rising and sitting motion, and the levers located at the hips and knees are designed to help the rider perform each phase properly. So the muscles should be strong enough around each lever system at the joint to assist the rider in performing the posting motion correctly and fluently. Obviously, the longer the leg, the longer the torso, the longer the forearm, more stability. If the rider does not have developed muscles around those levers, so the left is an improper rising position, the right is an improper sitting position. If the rider's agonist and antagonist muscles in each phase are unable to support their weight, the levers and the joints will be negatively affected by the laws of motion. So the amount of force that's supposed to be used in the lever to help the rider rise and support their body weight is not there. If the rider is unable to support their body weight, the third law of motion will cause the rider to fall back down, which pretty much means whatever goes up must come back down. Gravity just literally causes the rider to just flop back into the saddle. Here's a summary of what I've gone over. In discussing the kinesiology behind posting, I have addressed the phases of posting and the axis and plane in which it is performed, the origin, insertion, innovation of the muscles used, as well as the type of contraction the muscle is in during each phase, the biomechanics involved, such as the center of gravity, levers, laws of motion, and the mechanical advantages some riders have over others. I also compare the proper versus improper posting position and what causes the rider to post improperly. Thank you.